Hello, everyone. I wanted to thank you for having me here today to go over my seminar called Kicking College Weight Gain to the Curb, Essentials and Simple Solutions. So a little bit about me. My name is Marie Parks. I have over 8 years experience in the nutrition field, but I have 8 years in the dietary supplement industry, ranging from giving health advice to formulating products and also as a research scientist helping to write articles and health protocols for a textbook. I did my undergrad in nutrition and dietetics at Cornell University, and currently I'm working on my master's in applied nutrition at the University of New England. In that lovely picture in the lower right-hand corner is me as a competitive runner at Cornell. I wanted to use that as an example just to kind of explain why I wanted to present this seminar to you today, because I did struggle with freshman weight gain when I started at Cornell, and because of that, I ended up getting injured and having to redshirt or take off a season, but I did eventually get back to a healthy weight and battled the injury. And I know some of you, or for most people living away for the first time, and you're facing a lot of freedoms and responsibilities that you didn't have to before college. So I wanted to give you some tips and things to look out for, be aware of, so that you can prevent weight gain during this time of your life and hopefully into the rest of your adulthood and after. So what we'll be going over today is the background of obesity, who's at risk, what causes it, and what are the health effects that it has. How can you prevent obesity? We'll go over nutrition, just the basics, the role of macronutrients, and basic label reading. Oops, sorry about that. We'll identify some barriers to eating healthy and maintaining a healthy weight by lifestyle decisions and how to overcome them, as well as some suggestions for how you can incorporate changes into your lives so that the healthy choices are the easy ones. So obesity, you got a sneak peek of this slide. Basically, it is a body mass index, or BMI, of 30 or higher, and BMI, you can see, is weight in kilograms divided by height in meters squared. You can really plug it into Google and it'll calculate it for you. You don't have to do it by hand, but it's not the most accurate way of determining how healthy you are, but it is the industry standard for determining if you're overweight. It doesn't take into consideration muscle mass, which is why, but just this is what we're using as the measurement of obesity for the purpose of the lecture. More than 33% of adults are obese right now, or that was from, I think, the 2016 statistic that I had. But we are on pace for nearly 85% of American adults to be overweight or obese by the year 2030, and we do not want that to happen, which is one of the reasons we're trying to help you out. So everyone is vulnerable. Even if you think that you can eat anything and you won't gain weight, it'll eventually most likely catch up to you. So I've just provided some statistics here. In 2011, around 27% of U.S. college students were obese and overweight, which right now it's probably even higher since it's 6 years later. In the age range that is the greatest increase in obesity is the range that you probably fall within, which is 18 to 29 years. And if you look at the chart to the left here, it shows the recent rise in obesity rates. If you look at the line segments more to the right. And that top blue line is adults, and the bottom green line is youth ages 2 to 19 years old. So just keep in mind that that term freshman 15, I'm sure you're all familiar with, was coined for a reason. So there are uncontrollable and controllable causes for obesity. Some of the ones that you can control are how many calories you eat, or how many you take in versus how many you expend, which is through physical activity, or your eating behaviors. eating a lot of high sugar and foods high in saturated fat are associated with obesity. Your meal frequency. There's not really a best strategy here. If you eat too many meals, it can give you too many calories, but also if you skip meals and then eat large meals, your body might not be able to metabolize it properly. And also portion sizes. If you're eating meals that are multiple portions, which is common nowadays, especially when you go out to eat and they serve you what looks like one serving, but it's really 4 or 5 or less maybe, but some restaurants do give multiple portions. So you just have to watch out for that. And I mentioned physical activity. Also sleep. If you're tired, you're probably not going to go work out. You'll most likely take a nap or just hang out. And you'll be more apt to make poor eating choices. And also stress plays a role too in obesity for a lot of different reasons. So some of the non-controllable causes, or which are beyond your control for the most part, are genetics or your family history. And just keep in mind for these, even though they aren't as within your control as the others, it doesn't mean that you shouldn't take action and try to be proactive against combating weight gain and or obesity. Your age, the older we get, our metabolism decreases, making us more susceptible to weight gain, whether you're male or female, race, ethnicity, and certain endocrine disorders like an underactive thyroid. Medications like antidepressants or blood sugar medications, these just have some common side effects that are associated with weight gain. It doesn't necessarily mean they are definitely going to cause weight gain in everyone. And sometimes if people are able to manage their health issues, they can either lower their dose of the medication or go off of them, and then they may lose some of that weight. Also, one's environment. What's your social economic status? Do you have enough money to purchase healthy food? Do you feel safe to get it? Do you even have access to food places that have healthy food? And some foods or even just products that we use on a daily basis, like soaps and detergents, have chemicals that can disrupt pathways in the body that can impact weight gain. So these can also be controlled if someone can move to a safer neighborhood, or maybe they have more access to stores, or if they get a promotion, or they can improve their socioeconomic status. Some of the health risks of obesity, which I'm sure you're all familiar, that obesity isn't linked with better health compared to those who are a healthy weight or normal weight. Obesity increases the risk of all causes of death, like mental illness. You're more likely to be depressed or anxious. You can have memory impairment, sleep and breathing disorders like sleep apnea. I'm sure you've seen those CPAP machines that people have to wear when they sleep. Chronic pain, type 2 diabetes, high blood pressure and cholesterol, heart disease and heart failure, stroke, different types of cancer, and overall lower quality of life. So why do we want to prevent obesity instead of try to reverse it? Even though it does occur gradually, which you might not know you're gaining weight right off the bat until your pants can't be buttoned, it does take longer to lose it, and it's definitely harder. So we don't want to have to do that. We want to prevent it. So unlike the last slide, where it was all undesirable health effects, preventing obesity is associated with desirable health effects, like increased energy, increased well-being and happiness, and optimal brain function, which who doesn't want better grades? So just a basic guide to prevention. You need to understand basic nutrition and what to look for on a label and implement regular physical activity. You also need to recognize barriers and reasons that influence you to make less healthy choices and learn how to overcome them. And have confidence, because the more you practice these healthy behaviors, the easier and more natural they'll be. So now we'll get into a little bit of nutrition education, which you probably are familiar with, but we'll just go through it to make sure we're all on the same page. So calories are the energy that you get and use from food. And the amount that people need varies according to their age, sex, height, weight, disease status, and activity level. And you can use any tool, well, not any, but there are a lot of different tools that you can use to calculate that. I just put one here. You'll put in all those factors and it will give you the approximate amount that you need on a daily basis to maintain, lose, or gain weight. The average male needs about 2,500 and females need about 2,000. So 3,500 calories is equal to about a pound. So if you want to lose a pound, you need to expend 3,500 more calories than you take in, or take in 3,500 less calories per day if you're not expending any. And so this can be done by cutting calories, exercise, or a combination of both. Carbohydrates are your body's main source of energy, and your brain needs them to function, or glucose, which is what carbohydrates are made up of. So if you are looking to start a low carbohydrate diet, probably would recommend waiting until after finals week. And there are two types of carbohydrates, which you've probably heard of. They're simple, which are like sugar, white bread, pastries, and these are absorbed fast. They can cause spikes in your blood sugar, so you'll get a burst of energy, and then all of a sudden you'll crash or feel tired. You're likely to feel hungry not too long after eating them, and these are associated with poorer health and obesity. Compared to complex carbohydrates, which you want to eat more of, which these sources of complex carbohydrates are whole grains, which are sources of fiber, which we'll get into in a moment, brown rice, barley, and oats. And these are absorbed slower than simple carbohydrates, so they have less of an effect on your blood sugar. They'll provide you with more sustained energy and help you feel full longer, and are more associated with overall health. So 45 to 65% of your calories should come from carbohydrates, and since they have 4 calories per gram, you can calculate it out that way. I just did an example for someone on a 2,000 calorie a day diet. And no more than 10% of your daily calories should come from added sugar. So fiber, which I mentioned before, whole grains are a source of fiber. These aren't digested or absorbed. They help you feel full longer and have been shown to promote a healthy weight because of that. And they help push things through your digestive system efficiently, so they can help with regularity, maintaining healthy levels of cholesterol and blood glucose. And sources of these are whole grains, like I mentioned, fruit, vegetables, legumes, which are beans and peas, as well as nuts and seeds. And the recommended intake for men is 38 grams, and for women is 25 grams. If you haven't been eating a lot of fiber, you don't want to just go right up to that recommended intake. You want to increase gradually and make sure to drink a lot of water, which you should be doing anyways. So protein is not just for bodybuilders. In addition to being the building block for muscle, it makes up body organs and tissues. Protein is made up of amino acids. There are 20 of them. And they're associated with appetite control and weight management. Like fiber, they can help you feel full, or protein can help you feel full. And to calculate your requirement of protein, it's based on your weight and how physically active you are. And a lot of times if you look it up, it'll say a certain amount of grams per kilogram. I put here a range of grams per pound of body weight, since we measure weight usually in pounds instead of kilograms. So if you're more active, you're going to use more like 0.8 grams per pound, or if you're less active, you'll use around 0.35 to 0.5 grams per pound. And some of the main sources you probably know are meat, fish, eggs, legumes, milk and yogurt or dairy, and tofu and nuts and seeds, as the last two are more for vegetarian and vegans. You want to choose lean proteins like chicken and turkey. Make sure they're skinless and the breast meat. And low-fat milk or yogurt, particularly Greek yogurt, is a good source of protein. And in a moment, we'll finish this slide and the rest of the presentation in part 2.